ways off, and now you can see how the analogs are hollow, and then we will just simply put the prosthetic on and drill holes right through the prosthetic. That's the C2F method. Okay, now we're going to drill through the prosthetic, and one of the keys is to making sure that this is totally passive before you start drilling, right? It's a very tight tolerance, so you always want to have a foot pedal. Right, so it's nice and passive, and then we'll just simply drill right through. Do a little pumping. You don't want it to get too hot. You almost can't avoid the heat, but watch the drill come through, the bit come through, right there. Okay, now that couldn't be a better spot, exactly as we planned it. And we'll just move on and drill the rest of the sites. And we'll record one more just for fun. So that's the second one, and then we're gonna come right through number 8. All right, so it's nice and passive, yes, get it spinning, and then drill. Pump. All right, so you can remove the excess. Make sure the prosthetic is totally down. Do not let it teeter. If it teeters, the whole trajectory is off. So look at that spot. It could not be any better. 1, 2, 3. This is a nice angle right here. Get the focus there. You really don't want to move implants in surgery because inside of this prosthetic is a titanium substructure. You can see there's just the edge of it right there. But you would not want to have to section or drill outside of that ring. Inside there's about a 6mm ring, so you don't want to drill outside of that. So it's very important to keep the surgery accurate. More so than accurate, but consistent with the plan. Okay, all the holes are drilled now. Nice small holes. Next step is to attach the prosthetic to the temp copings. So we'll put the MUA heads back in here now, into each one of these, and then we'll put the temp coping on top, and we will attach to the natural prosthetic. Now with normal FP3, normally there isn't a whole bunch of a gap. All right, but on FP1, these implants are deeper. We're a little conservative with the necks, so we may have to end up using some taller copings. Maybe not even the pre-cut ones, but use some taller ones and really try to get some coping up into this prosthetic. Okay, so maybe these pre-cut ones will be tall enough. What we always want to do is we want to do one at a time. All right, not all 6, because you cannot find where the passivity is and where you need to adjust. So one at a time, and you just adjust the prosthetic until the coping fits inside of it. All right, so we're a little ways off here, which is, it's okay. You see how it's teetering on the one? That's how you know to adjust that one. If there were all 6, it'd be tough to figure out. So I'm going to remount that hole a little bit more with just a BB burr. Do not violate the occlusion. Right? In other words, you don't want the hole coming through here, because then you have a little more cleanup work. Now, most people doing this are going to be dental technicians, and they can fix just about anything. But why break through the occlusal if you don't need to? All right, so I'm still teetering a little bit. So I'm going to fuss with this for a little while, and I'll be back when I have that down. All right, well, that was just one more take. So I was drilling a little bit deeper, but it really just needed to be wider. So you just have to kind of feel it. You know, it can always be a little bit wider, because you're just going to backfill it with material. But deeper, geez, you might get into the occlusion. So 1 down, 5 to go, and I'll be back once they're all adjusted in. Something very important to note is you can see from the plan, these are dead on middle of the holes, right? So we make some wells, we drill the small hole right in the middle. This one deviated a little bit, and so we are right at the metal here, deviated. So, but you can still follow the channel of the hole to know where to widen, right? So we're gonna widen here a little bit, not here, here. This one, do you see where the trajectory of it is a little bit distal facial, because that's number 8. So distal facial right here. This one was pretty much right in the middle. And this one we need to just open up trajectory. So really the only one that was off a little bit is 8. I believe so. But that'll tell you exactly the trajectory of the adjustment. All right, so on that particular site, on number 8, I didn't want to adjust any more inside the prosthetic. And I really didn't want this to be any shorter. So I just trimmed off, you can see it here, I trimmed off the facial, mesiofacial of this temp coping, just a tick. And now it seats. To show you here. So just a little bit of that adjusted right there. And now the prosthetic seats exactly as we want it to. All right, there we go. Okay, just 2 more to go. They are all down. It's exactly what it should look like. All right, so all the copings are in. They're fitted. Now the trick is to lute them together, because with natural we don't have injection ports because there's a metal liner in there. So we are going to just drop down material from the intaglio, keeping the prosthetic like this, so gravity takes the material downward. We're going to use Stellar DC acrylic resin, the tooth white color. It's approximately an A2, a little more bleachy than an A2. That's the material we're going to use really on all these cases. Let's do a little walkthrough first. I opened up a little bit of a divot right here so I can get the tip in. But the goal is to hold the prosthetic with teeth down. Okay, and I'm just going to basically drip material down into each one of these sites. And I'm going to try to put some blockout rods in here, like always. And just gonna let gravity flow that material down in here. All right, most of these cases are 6 implants, and C2F kit has these rods. All right, the rods just simply pressure fit into the holes, and they pressure fit into the temp coping. So they really do a nice job of blocking out. Now you'll notice this came up a little bit here, right? And this is up a little bit over here, a little bit. So we're gonna go ahead and inject, and then we'll push the prosthetic to the model, and then we'll hit it with a light. Right now it's not that important that it's closed down. Really the most important thing is that everything is blocked out. And in FP1, generally the prosthetic is pretty thick, so there's friction in there to hold these blockout rods out. Okay, here we go. So I'm not going to record the whole thing, but the idea is that we're just going to fill this. We try not to make too much of a mess. I mean, we're going to end up doing a little bit of work afterwards, but I'm just going to force some material down in that hole, in that well. Same thing here, just kind of overdo it a little bit so that the gravity takes the material down. Okay, you can just kind of see it kind of welling up and over. And that's okay anyway, because you really want material around that temp coping on an FP1. You know, it's not like an FP3 where you can leave some of that coping exposed. You really want to build an emergence, a neck, if you will, a neck of material to displace tissue so that you don't have growth inside that sulcus, and then you end up 6 months down the road having to make a prosthetic that's inferior because the necks are too thin of the prosthetic. Okay, so I'm just kind of tapping it on the model here, right? Kind of like vibrating this into place. So now I know some of that material is flowing down into the into the wells. Okay, now I'm going to make sure the prosthetic is down, and I'm going to hit it with a light, and then we'll take it off and clean it up a bit. Okay, I'm hitting it with a light. Try to get a 2 full minute cure in here, self cure, but I'm going to hit it with a light, and then because this is a very delicate time in this, in this juncture of this conversion, because we've really only tacked these temp copings in, and so when we take the prosthetic off, we want to be very delicate with those gold screws and know which ones have definitely come loose. Go from left to right, and you can hear the clicking of the screw when you know it's disengaged. Okay, it's cured in. Now we want to take the prosthetic off the model. So let's take these block-out rods out, and you can see down in these holes. You can see all the way to the screw head, so the channels are clear. Okay, they're all out. If we can get some light down in there, you can see the heads clearly. So all the channels are nice and clear. Next step is to remove the prosthetic. So just simply take the gold screws out, remove the prosthetic, and then we will flip it over and we'll finish off the luting process. Okay, I delicately took each one of those screws out, but as you can see, the luting was nicely done. Right, almost circumferentially around each site. So we're really just about done with this. Now I'm going to add some material to just to come up a little bit higher on the necks of these temp copings, but essentially we're just about done here. What I did was I just opened up a couple little spots because I really wanted to get some material around the facial of this. I opened this up with a BB burr. I opened this up here a little bit here, and I'll just flow some material down in these areas and clean it up. And of course, then we got to cut the arms off and just adjust and polish. Just adjust and polish the areas where these arms are connected. I'll show this part. You can inject in here, and it just kind of gives a nice flash around the outside. I'll leave a little bit of material there. Really, just like with all the FP3s, I don't like to add too much material and then adjust it away. So, I'll just force a little bit of material down in the areas where it's missing. Right, force it in, kind of massage it around. Right here is a port. Let me inject that. You see how the flash comes up? Totally filled that void. And I'll take a little curette or something and clean around that. Right here. Oops. Inject. Material comes up. Inject. And that's it. And then I'll just take a little, some kind of little tool, clean it up, and then hit it with a light. Here we go. Might as well clean it up before it gets hard so that you don't have to hit it with a burr too much. There, clean up this interproximal spillage right here. Why set it up so you have to grind it and adjust it? Time is of the essence. The patient is right now getting sutured and healing. Right, so why prolong it with adding material and cutting it back? The whole goal is to just get these temp copings in here securely. So that's looking really, really darn good here. Okay, like mission accomplished. I'm gonna cut these off, smooth it out, and we'll be done. To cut these off, this will be baker's choice, but I'm just using a disc. All right, it's nice to keep, that way you can keep it straight and flush instead of hitting it with a burr and making it uneven. I'll hit it with a disc and then I'll adjust it with a burr. I removed the arms, the support arms, polished it. Could probably do a little better job here on number 8 there. But this is ready to deliver. We'll have to decide if we're going to cut these molars off. I'm thinking we're going to. I just got to remind myself of what's on the opposing. Otherwise, we're finito. Now, one thing I always like to do before I deliver this back to the doctor is take an OEM screw drop it in, and make sure you can see threads. You can see threads. Of course, OEM screws don't quite sit like the gold screws, so I'll get that out of there. But make sure you can see threads on the underside of all these before you take it back to the mouth, because you don't want any surprises. And one last tip: if for some reason a screw is not coming back out, just take the C2F drill and just bore the holes out a little bit. You should be able to freely spin them 360, because sometimes you get a little gunk in there, or maybe there's some, during the injection process, some material spilled over into the channel. So just clear them all out until a screw fits passively. And if you need to, put it back on the high speed, the handpiece, and just ream it out a little bit until you can touch the top of the temp coping. There's no harm done, because you're not going to touch a screw, just the top of the temp coping. One last follow-up on the conversion. We did end up cutting the molars off, had a little chat with the doctor, and of course we did. I mean, you have to remove them. The patient doesn't have dentition down there, but you don't want to risk it. So we'll add them back in at the final. Nice thing is, on the rapid appliance, the molars are here, so we can do a nice reline impression and pick up the tissue in a few months, several months. My goodness, I mean, this is as good as it gets, I think, with FP1 delivery. All right, so lovely job of suturing. These are the healing collars. They were removed and the prosthetic was seated. Really not much trouble at all with the seating. We try to keep these MUAs a little bit subgingival, right, because you're going to have recession. But look at the markings. This was not a burr, not one burr touched this occlusion. We even have a little bit here on the anterior, but the doctor just simply seated it here. I think I have a video. So this was right after insertion, using an indicator tape, and the patient finished, stood up, and went home feeling good.